When you first met each other, you're more tolerating about each other's bad habits.
Yes.
But then after like a year of living together, little habits become, from cuteness to annoying.
Falling in love and getting married is the easy part. It's staying married or staying in a relationship that is really a lot, it's work.
Pieds-tu keble concepon-toi, metu bese fomo quantua, pol cuidatu quenetole fontie keresu.
Hi everyone, I'm Dr. Margaret Li, licensed clinical psychologist in California. If you're new to the channel, I cover topics such as anxiety, stress, relationship, dating, marriage to help you gain more insight on psychology and create a life with more inner peace and emotional freedom. This week, I'm inviting my friend and colleague Annaliese Taylor to answer questions about couples therapy. Annaliese is a licensed marriage and family therapist in San Francisco Bay Area. She specialized in working with couples over the past 10 years. Without further ado, let's hear how Annaliese answers all these questions about couples therapy.
Hi Annaliese, welcome to Psy.D Easy.
Hi Margaret, nice to see you. Thanks for having me.
Of course, I'm so happy to have you in the show today. So Annaliese, can you tell us a little bit about your practice?
Sure. So I started working with couples in 2010, and over the course of the last 10 years, I have had training in Gottman method couples therapy and emotionally focused couples therapy, which are the two evidence-based, empirically validated forms of couples therapy out today. It's heavily researched and empirically validated to be an effective forms of treatment.
Great. So can you answer some of the questions that like lots of my couples actually have? When I start doing consultation with them, they're pretty hesitant to enter couples therapy because it's not something that we advertise a lot. It's not something that I ask testimony from our clients, right? So all the bad rap is sometimes from the media, sometimes from word of mouth. Some of my clients usually ask, what is couples therapy and who's it for? Like, is it only for couples that are getting a divorce or have like significant problem?
That is a really good question. So couples therapy is actually really helpful, I think, for anybody in a relationship. A lot of the times we find that people come into couples therapy almost too late. And so usually, anytime you notice like your bond in your relationship to start to feel like a little bit disconnected, or you're having kind of these recurring disagreements about something that's really feels like a gridlocked issue. Like if I had to compromise on this, it would be like removing the bones from my body. And so like those are some of the reasons why couples come into therapy, is to kind of build connection, build safety in relationship, and also to try to deepen their understanding of their partner. And usually what we find is that conflict in relationships is inevitable and actually has very necessary functions to a relationship. It helps us love and understand our partner better. It helps us deal with change over time, and then renew our courtship over the years as we adjust to raising up, bringing up kids, empty nest syndrome, career changes or financial stress or anything else that can kind of pull away from the relationship. Couples therapy can be really, really beneficial to help the couple reconnect and just kind of understand what's happening for the other person on a deeper level.
Okay. But I also hear, couples say like, well, where's true love? Like, aren't we supposed to get along? Like, aren't we supposed to be able to solve these problems by ourselves? Why do we need a third person?
Right. Yeah, falling in love and getting married is the easy part. It's staying married or staying in a relationship that is really a lot, you know, it's work, it's putting energy, you know, in the age of technology that we're in, and we're just in such a fast-paced environment, and we're all juggling so much. It's so easy to forget to put energy into our relationship. And so that's usually often what we find, is that once we start kind of forgetting about, okay, what were we doing when we first started dating, or when we first decided to marry, before we had kids, what were we doing? We find over time that couples actually stop doing the things that they were doing when they felt deeply in love, when they first started being together.
Yeah, sometimes I tell my clients that, like, you know, when you first met each other, you're more tolerating about each other's like bad habit. Like, you even are kind of proud of it and be like, oh, that's so cute.
Yes.
But then after like a year of living together, right? Small habits such as like putting the toilet seat up or down, right? Or how do you put the, you know, toilet paper roll, right? All these little habits become from cuteness to annoying.
Absolutely. And actually what they found in research is that there are different phases of a relationship. The first phase is called limerence, and that usually lasts like anywhere from like 1 to 2 years. And limerence is where you're getting flooded with oxytocin. And so you're kind of like blinded by your partner's, character flaws, so to speak. And we kind of overlook those because we're so excited to be in love. And then after a couple of years, you start going into a phase called disillusionment, where then you start to kind of really, the limerence phase kind of wears off, which is normal. And then you start to really notice like the qualities that you maybe didn't paid much attention to, or thought weren't that serious. You start to kind of pay attention to them and decide, oh, this is a problem for me. Leaving the toilet seat up is a problem. And so those kinds of things, then you find that couples get into these arguments or spats about the toilet seat. But really, you can guarantee that sometimes those like surface level discussions are really not about the toilet seat or who's going to take out the garbage. It's really about connection. It's really about connection. So yeah, what you're saying is absolutely true. That limerence phase starts to wear off, and then you start to deal with the actual person.
But what do you do with problems such as like, do you want kids? How many kids do you want, right? Am I gonna lose my freedoms if I have kids? Like, how do you work with those? Those sounds like very kind of deal breaker questions, but you're already married.
Yes, right. So usually when we run into those kinds of issues, like what we call like gridlocked issues, it's usually, those are, about 70% of all problems in relationships are perpetual, meaning they're not going away. And usually what you can find is that underneath those gridlocked issues are something that's really important for the other person, and it's connected to a partner's value system, their personality traits, their lifestyle preferences, and so those are stable parts of each person. And so it may not be so much you need to come over to my side and agree with me, but it's really about, let me deepen my understanding of why that is so important for you, why you feel so firmly about not having kids. Did you have trauma? Are you afraid that you're not going to be a good parent? And we can in therapy, in couples therapy, we can really get underneath the meaning of what these issues are for each person, and then kind of increase the other partner's empathy and understanding of that. And then that has this natural, it's almost like a shot to, like a tranquilizer to your central nervous system. It has this calming effect on partners, and it keeps the conversation less intense. And then you find that there's more flexibility. Oh, when I feel understood, I'm more willing then to understand why this is so important for you to have kids.
Yeah.
Even though I've had a really hard upbringing, I get why you want to have children with me. It makes sense. So those and the extent to which a relationship will work out is based on whether or not you've wound up with a set of problems, perpetual problems that you can deal with.
Yeah.
And then when you have these kind of conflicts, how are you talking about them? Are you making repairs when you do something that maybe has hurt the other partner? And then is the other person being able to accept that other person's repair attempts in these kinds of conflicts? So those are all really important aspects and indications of a successful relationship.
Yeah. So I also hear couples say it doesn't work, like couples therapy doesn't work, or it will only make it worse, right? Why don't we just move on?
Right. Yeah, that happens a lot. It happens a lot. And, a lot of people, what they found, so the emotionally focused therapy, which is the type of therapy that I use in my practice, it actually has it has an 85% success rate for improving a couple's distress. And then when they did follow-up studies, after, I believe it was after 5 years, what they found is that about 70 to 73% of those couples, it did not have a relapse. So it had long-lasting effects. And the reason why that works is because emotionally focused therapy in particular, it works with emotion. It works to kind of help the couple talk in a way that feels safe, and they're having these kind of quote unquote bonding conversations. It then has lasting effects. You're doing things in the therapy that you wouldn't have done outside of it, in terms of taking risks by telling your partner your more vulnerable feelings, and having the experience of your partner really attuning to that pain that you might be experiencing, or the sadness or the loneliness, or the fear. And you're having these moments where you feel then safe with your partner, and then that carries outside of the session into home life. You start to have these conversations automatically in your in the relationship at home.
Yeah, being in the Bay Area, I have so many clients that talk about their spouse like, wow, we never talk about emotional topic. Like, we usually avoid it because first, we don't have the language for it, right? Like, second, like, it's very uncomfortable. So a lot of tech company, right, that's probably not our strength to talk about emotion, right? But then relationship and marriage is such an emotional experience, right? Yes. So when you avoid the negative, you're also avoiding the positive.
Absolutely. Sue Johnson, who is the creator of emotionally focused therapy, she talks about emotions as the music that we dance to in our relationships. And when we overlook our feelings, so our feelings, from the a therapist perspective, and what we know about it, the way emotions work, is that they're information. They're not good or bad. They're just information to tell us how to get our needs met, how to validate ourselves, and also prepare us to communicate to our partners what is really important to us in this relationship, so to keep everything in balance. And so when we say, oh, I don't want to deal with emotions, or I'm afraid to look at this because I'm afraid that it might get worse. Usually when we avoid something that's kind of gnawing on us in our relationship that we can't kind of overlook, we feel disconnected. There is this hardwired in our attachment system, this fight or flight response that goes off in our bodies to say, hey, this is not meant to be, because I am meant to be in this tribe with my partner, and this feels like it's threatening my survival. So then these emotions start to go on that we can only push away so long before then they start to build and get bigger. So sometimes if we say, oh, I don't want to look at that actually, and that's, I think when I started, I said couples, they tend to come to therapy too late because they have tried that. They have tried to kind of table it or push it away.
Yeah. I usually tell them that, hey, your emotions are such important signals that something is wrong. Something is not clicking with you, right? That's your gut feelings that we talk about, right? Trust your body, work with your body.
That's right. You are your own expert, and there's something really, really important happening inside.
So I guess the last concern that, a lot of couples are like, this is great. Like, it sounds like a great idea to, have a professional to help us, but does it take forever? Like, once we start seeing a couples therapist, do we have to see them for life? Like, can we just solve it by ourselves? We don't really have that type of money.
Right. Yeah, that's a really good question, because you do have to have a resource often to go to couples therapy. Just to address, is this a lifetime situation that I'm going to have to be in couples therapy for the rest of my life? Emotionally focused therapy, what they find is that you can move through all the stages of therapy depending on what the kind of level of disconnection and distress in the relationship is, and how much injury there has been, anywhere from like 8 to 22 sessions. If there's a long history of trauma, then maybe a little bit longer, but generally you can expect to kind of be in therapy for that long. For couples who don't have resource to even do 8 sessions of therapy, there are some really good options out there in terms of with emotionally focused therapy. There's Hold Me Tight workshops where you can pay to just do like a weekend course, and you move through some of these steps in emotionally focused therapy by having these kind of it's almost accelerated bonding conversations with your partner that has these a corrective emotional experience in the workshop. And then also Gottman Method has workshops that are based on their research and their book, 7 Principles for Making a Marriage Work. So they also have workshops in terms of deepening your level of understanding and how you communicate some of your fears and your longings with your partners. Those have been proven to be very helpful. And also, if you wanted to start with those, they jumpstart your therapy so that you wouldn't have to pay as much. There are also employee assistance programs out there that sometimes companies will pay for a certain amount of sessions. And there are also couples therapists out there who will keep a couple slots on their caseload for a sliding scale. I think that there are some community-based resources out there that do couples therapy that would be able to do sliding scale couples therapy.
Yeah, and also you get reimbursement from your insurance company, right? Sometimes as high as like 80% reimbursement.
That is also a really good point. Yeah, so if you have an insurance benefit that covers couples therapy, that's right. You would just be paying kind of like a co-payment.
Wow, thank you so much, Annaliese. I feel like those are the top questions that are asked by my clients all the time. Are there other questions that are asked by your clients that you feel like the audience will benefit from knowing them?
Yeah, I think when I go into therapy, I really just explain what it is, like what to expect in therapy. So like usually the way that, like, for example, because I'm mainly doing emotionally focused therapy, I kind of go through what it's going to look like. So in the first stage, it's really making sure that I'm in alignment in terms of our relationship with each partner, that the relationship is mutual. And I spend a little bit of time with each person individually to make sure that I understand your own personal histories. And then what we do is we try to examine what is happening in the relationship, in the dynamic of the relationship. And so it's really kind of taking this non-pathologizing approach to looking at the relationship and understanding what's the process, what's happening in this kind of dance that we do. And then in the second stage, what it is deepening the understanding of what's behind the conflict. What are some of your attachment fears and longings? And then helping couples to really own them and then articulate them and have the other partner really accept that as valid. And then in the third stage is really what you find are that couples are they're able to kind of really take a new approach to old problems. So because they have this new bond with each other, they're able to then tackle all these kind of old gridlocked issues that would come up before in a way that has flexibility, and somehow they're able to kind of get to that place of compromise on their own because they have this connection, like my partner cares about what I want. They have this felt sense now.
Well, thank you so much, Annaliese. I think those are really helpful questions to just get everyone started, right? To start thinking about their relationship in the long run.
My pleasure, Margaret. Thanks so much for having me.
Yeah, thank you. Bye.
Bye. Take care.
So that's it from me and Annaliese. If you have any questions or comments about couples therapy, feel free to leave a comment below and let us know so that we can all learn together. This channel is all about empowering you to gain more insight on psychology to create a life with more inner peace and emotional freedom. More videos like this every Wednesday. Be sure to hit subscribe, and I'll see you next week, same place, same time. Thank you so much for watching. Take care.